Have you ever noticed that sometimes your face changes and you don't even know how to explain why? A dark circle that's darkened, some unusual swelling, a spot that appears out of nowhere? What few people know is that the face is one of the first places where the body shows signs that something internal isn't right. And in today's video, I'm going to show you exactly that, all in a simple, direct, and easy to identify way. So stick with me, because understanding these signs can help you detect problems early and even prevent future complications. Let's get started. A rounded and overly full face. You know when a person starts to develop a rounder face shape with very full cheeks and a moon face appearance? This usually isn't just about changes in weight. This type of facial swelling has a lot to do with hormones, especially cortisol, which directly influences how we retain fluid and redistribute fat throughout the body. It's as if the face is the first place to reveal this imbalance. In Cushing's syndrome, cortisol levels remain high for a long time, either due to the body itself or from the prolonged use of corticosteroids. And when that happens, the skin thins, small blood vessels appear on the face, the texture changes, and even pimples can appear out of nowhere. It's that combination of signs that, when you put them together, makes perfect sense. The body has been under enormous hormonal stress for weeks or even months. And why does this matter? Because the face provides this early diagnosis, even before the person realizes they're more tired, more irritable, or have less energy. The facial change has already appeared. And when we treat the cause, whether by adjusting medications or regulating cortisol, the face responds quickly. The swelling goes down, the skin improves, and your expression returns to normal. Bulging eyes and retracted eyelids. When the eyes start to look more prominent, as if they're always wide open, it tends to draw attention. It's that more exposed, almost startled look that often shows up first in photos. And of course, this has nothing to do with being tired or with genetics. It's a classic sign of a thyroid alteration, especially when it comes with palpitations, weight loss, or excessive heat. In Graves' disease, the immune system inflames the tissues inside the eye socket. The extraocular muscles, both rectus and oblique, increase in volume, and the retroorbital tissue swells. This pushes the eyeball forward. That's why the eyes look more exposed, the eyelids retract, and you get that gritty feeling, tearing, and an exaggerated sensitivity to light. This is one of the most specific signs in endocrinology. And there's an important detail. Even after treating the hyperthyroidism, the eyes don't always completely return to how they were before. The inflammation can leave residual changes in the orbital anatomy. What improves is the discomfort, the edema, and the progression of the condition. In other words, when the face changes in this way, it's literally showing that something big is happening inside, and that it deserves prompt attention. Dark, velvety patches. You know when the neck starts to darken gradually, developing a thicker, almost velvety texture that just doesn't seem to wash off? This is one of the most characteristic signs of insulin resistance, and it often appears years before blood sugar levels rise in tests. Many people mistake it for dirt or dermatitis, but it's the skin showing a metabolic imbalance inside. Acanthosis nigricans occurs because high levels of insulin stimulate the proliferation of keratinocytes and melanocytes in this area, making the skin thicker and more pigmented. This darkening can occur on the neck, armpits, groin, and even along the jawline. And the higher the degree of insulin resistance, the more evident this patch tends to be, making it an extremely sensitive skin marker. And here's the correct information. Even when metabolism improves, the acanthosis may not disappear completely. Some patients experience a reduction in the thickness and intensity of the pigmentation, others see it stabilize, and for some, it hardly changes at all. It all depends on factors like genetics, how long it has been developing, and associated conditions. The important thing is to understand what it means, that it's an early warning from the body to pay close attention to hormones, metabolism, and lifestyle. Persistent mandibular acne. When acne repeatedly appears on the jawline, chin, and neck, that deeper, inflamed acne that leaves marks, it usually indicates a very strong hormonal component. It's not the same as teenage acne, nor is it the kind caused just by oiliness or stress. This pattern, when it persists, is one of the most typical signs that there's an internal imbalance happening. In polycystic ovary syndrome, there's an increase in the action of androgenic hormones, which stimulate the sebaceous glands to produce more sebum. And the important detail is that the mandibular region is extremely sensitive to these hormones, which is why the pimples appear there, and not randomly across the face. And in many cases, this type of acne is accompanied by menstrual irregularity, increased hair on the chin, or difficulty losing weight. And here comes the fundamental part. Treating PCOS is not a guarantee that the acne will be completely eliminated, but it almost always reduces the intensity and frequency of the lesions. It's as if the face directly reflects the body's hormonal balance or imbalance. When the hormonal axis improves, the skin follows, sometimes slowly, sometimes more quickly, but always showing the direction the body is heading. If you're enjoying this video and want to understand the signs your body gives you better and better, especially those that appear on your face, go ahead and subscribe to the channel right now. And if this video has helped you in any way, leave a like down below. That way, YouTube understands that this content is useful and shows it to more people who can benefit from this information. Paleness, deep dark circles, and a tired look. You know that face that always seems paler, dull, with deep purplish dark circles, even when the person sleeps well? This is one of the classic signs of iron deficiency, and often it's the first visual warning before symptoms like excessive fatigue or shortness of breath during daily activities appear. And the skin is already starting to reveal what's happening in the blood. Iron deficiency reduces the body's ability to transport oxygen, and when the tissue doesn't get enough oxygen, the body tries to compensate by increasing superficial circulation. Iron deficiency reduces the body's ability to transport oxygen, and when the tissue doesn't get enough oxygen, the body tries to compensate by increasing superficial circulation. The result is that the eye area, where the skin is thinner, becomes darker, and the face gets that permanently tired look. Many people try to fix it with creams, concealers, or skincare, but if your iron is low, none of that truly solves the problem. An important point is that correcting an iron deficiency tends to improve skin color and dark circles, but the response varies from person to person. It depends on the duration of the deficiency, genetic factors, and how the body responds to supplementation or dietary changes. What really matters is understanding the signal. When the face loses its color, the body is asking for more oxygen, and that needs to be investigated. Sixth sign, butterfly-shaped rash. You know that reddish rash that covers the cheeks and the bridge of the nose, forming a pattern that looks like a butterfly's wings? When this redness is recurrent, gets worse in the sun, changes with the weather, and doesn't go away with moisturizer or skincare, it raises a major red flag. This pattern is one of the most classic findings of cutaneous lupus, and it often appears long before any more serious changes in the body. What happens is that the immune system becomes more reactive to light, and inflammation occurs in that area. The skin becomes more sensitive, gets irritated easily, and may even flake slightly. The interesting thing is that many people confuse it with an allergy, rosacea, or simple irritation, but the shape of the lesion, clearly defined on the cheeks and sparing the nasolabial fold, is extremely characteristic, and is a huge help for an early diagnosis. And here's the essential part. This rash doesn't automatically mean the person has a serious systemic disease, but it always needs to be investigated, especially when it appears along with sun sensitivity, hair loss, recurrent canker sores, and joint pain. The face is one of the first places where lupus gives a warning, and recognizing this pattern early makes all the difference in monitoring and quality of life. Seventh sign, enlarged jaw, wide nose, and thick eyebrows. Some changes to the face happen so slowly that the person doesn't even notice. The jaw becomes more prominent, the nose gets wider, the eyebrows look heavier, and suddenly someone says, "Your face looks different." This pattern of slow, progressive growth is one of the most characteristic signs of acromegaly, a condition linked to an excess of growth hormone in adulthood. In this condition, bone and soft tissues gradually begin to thicken. The jaw projects more, the cheekbones become wider, and even the teeth might start to spread apart slightly. It's as if the face is growing outward, but without pain and without any obvious warning. And precisely because it's gradual, many people only notice it when looking at old photos side by side, and the difference is often striking. It's important to note that even with proper treatment, these facial changes don't usually regress completely. What the treatment does is stop the progression, protecting the heart, metabolism, and other organs. That's why recognizing these subtle facial changes early can speed up the diagnosis and prevent major complications. Once again, the face speaks, and it speaks long before any tests do. Waking up with puffy eyes once in a while is normal. Now, when this swelling appears every day, especially around the eyelids, it can be a sign that the body is retaining more fluid than expected. This pattern, called morning edema, is usually more visible on the face because this area has loose tissue and vessels that are very sensitive to fluid variations. Two internal causes stand out here: mild kidney changes and thyroid dysfunction. With the kidneys, when the body doesn't filter fluids properly, the face is one of the first places to show the retention. In hypothyroidism, the accumulation of mucopolysaccharides in the tissues can make the skin look fuller, with a doughy and swollen appearance. In these conditions, the edema usually improves throughout the morning, but it returns the next day. And why does this matter? Because the face shows this pattern before the patient notices any other symptoms. Often, the morning swelling is the first warning that something is altering the hormonal balance or the renal system. Recognizing this repetition helps shorten the path to the right investigation and prevent a mild condition from advancing silently. When a person's eyelid droops at the end of the day, but improves after a few minutes of rest, that's not just simple fatigue. This variable drooping is called fluctuating ptosis. It's one of the most classic signs of myasthenia gravis, an autoimmune disease that affects neuromuscular transmission. The curious thing is that people first notice it in photos and videos or when someone asks, "Why is one of your eyes more closed?" In myasthenia, the muscles responsible for lifting the eyelids fatigue quickly. The person wakes up with a normal eye, but throughout the day, the eyelid starts to droop. Unlike structural eyelid diseases, here the pattern changes throughout the day and improves with rest. This is a detail that makes all the difference in the diagnosis. In more advanced cases, vision can become double, especially in the late afternoon. The face is extremely expressive, and ptosis is a very strong visual sign. Identifying this repetitive behavior, worsening with effort and improving with rest, can greatly speed up the diagnosis. The sooner myasthenia is recognized, the more effective the treatment is, and the lower the risk of it progressing to more complex conditions. When the lips start to crack at the corners repeatedly, peel in specific areas, and don't seem to respond to moisturizers, this can indicate more than just environmental dryness. This pattern, known as angular cheilitis or chronic cheilitis, is often related to nutritional deficiencies, mainly of the B complex, like B2, B6, and B12. The oral mucosa is extremely sensitive to vitamin fluctuations. That's why small changes in the levels of these vitamins can cause cracks that worsen when eating, smiling, or opening your mouth. In some cases, the area around the lips becomes red or sore, and the skin can't heal on its own. And patients with gastrointestinal disorders or very restrictive diets have a higher risk. Identifying this pattern is important because it points directly to the body's nutritional and absorption status. When the cause is corrected, whether by supplementing, adjusting the diet, or treating the gut, the area improves, but the response varies among individuals. And the face here is a mirror of the body's nutritional integrity. One of the most curious clues of hypothyroidism appears exactly where almost no one looks, at the tail of the eyebrow. The final part of the hairs starts to become sparser, thinner, and in some cases, partially disappears. This finding, known as Hurtiga sign, is a classic marker of a drop in thyroid hormones. In hypothyroidism, the metabolism slows down, affecting the hair growth cycle. Since the eyebrow tail is naturally more delicate, it's one of the first areas to show this loss. Many people think it's just thinning related to aging, but when it appears along with dry skin, the feeling of cold, and a slower pace, the pattern becomes much more evident. This change is usually gradual and often goes unnoticed until the patient compares it with old photos. Although hypothyroidism treatment can improve hair cycles, the eyebrow doesn't always return to its original appearance. Even so, the sign is extremely useful as a clinical clue, and the face, once again, becomes a map of the hormonal state. In scleroderma, a disease that causes excessive collagen production, the face begins to show very specific changes. The skin becomes tighter, shinier, and more attached to the tissue underneath. Facial expression diminishes, the smile becomes less broad, and in some cases, the mouth appears smaller. This phenomenon is known as microstomia, and it's as if the face were stretched backward. This happens because the excess collagen hardens the skin and alters its natural elasticity. Wrinkles decrease, not because the skin has become younger, but because it has lost its ability to fold. And in more advanced ages, even simple movements like whistling, opening your mouth, or smiling widely can become more difficult. And these changes are not very pronounced and evolve slowly. Recognizing this pattern is extremely important because it indicates the disease's activity and can help guide treatment and functional rehabilitation. Facial changes like these are not related to skincare, age, or lifestyle. They directly reflect the autoimmune process. And the face, in this case, is practically a mirror of the disease's progression. When the lips take on a more purplish tone and the facial skin appears more ashen, dull, and lackluster, this can indicate a slight reduction in tissue oxygenation. And this pattern has nothing to do with cold or superficial circulation. It's a sign that deserves attention because it appears in respiratory or cardiac conditions, or in sleep disorders like apnea. In mild hypoxemia, the tissues don't receive enough oxygen. This is immediately reflected in the color of the skin and mucous membranes. The lip area is especially sensitive because its vascularization quickly reveals the saturation level. Patients with chronic respiratory problems might notice this change when climbing stairs, after exercise, or even upon waking. Although this sign isn't a diagnosis on its own, it functions as a powerful visual marker. When someone has lips that fluctuate between pink and purplish, or skin that becomes more ashen at certain times of the day, it's worth investigating their respiratory and cardiovascular function. This is because the face is one of the first places where a lack of oxygen appears. A subtle yellowing of the skin, especially on the forehead, nose, and around the eyes, can be the first sign of mild jaundice, which is an increase in bilirubin that occurs in liver or biliary diseases. Unlike keratinosis, here the sclera can also turn yellowish, and some people report itching, especially at night. This pattern emerges because when the liver can't properly metabolize bilirubin, it accumulates in the bloodstream and ends up pigmenting the skin and mucous membranes. In the early stages, the face is one of the first places where this subtle discoloration appears. The itching is also important, as the buildup of certain substances can irritate nerve endings in the skin. Identifying this change early helps a lot, because mild jaundice can indicate several things, from a bile duct obstruction to hepatitis, medication use, or metabolic diseases. The face here is an early warning for investigating liver function, and the earlier this is done, the better the prognosis. And now I want to hear from you. Which of these signs did you already know, or have you seen them in someone close to you? The face really reveals much more than we imagine. It shows hormonal changes, metabolic shifts, autoimmune problems, nutritional deficiencies, and even diseases that haven't yet shown clear symptoms in the rest of the body. If you start paying attention to these details, you can catch a lot of things early. This makes a huge difference in long-term health. And if this video helped you in any way, subscribe to the channel and leave a like. That way, YouTube will deliver my content to more people.